Okay, guys, this is Mobeen. We are talking about the cardiovascular system general principles, hemodynamics. The lecture now is about the capacitance. So, capacitance is defined as the distensibility of a blood vessel. How stretchable it is. It is the opposite of elastance. Elastance means how much recoil it does. So, if imagine this was a rubber tube, if I stretch it, it would automatically go back. That is called elastance. Elastance is produced by elastic fibers present in the vascular walls. Most important and most elastic is the aorta. Aorta has 50 layers of elastin fibers in its tunica media. So when you press it, it would recoil, it would go back. That is called elastance. Opposite to the elastance is the compliance or capacitance. We say that a vessel or a chamber is compliant if you add volume to it and it just keeps expanding. So look, if this is a vessel, if I add volume to it, it just is expanding. It is not going back. So this is very compliant. So compliance means distensibility, how easy it is to distend without causing lots of recoil. Elastance is how difficult it is to distend because of the recoil. Compliance is also called capacitance, and it is the distensibility of a blood vessel or a chamber. Now, in the arteries and veins, this is another area where I see students to be confused very often. They think that all arteries are elastic and all veins are compliant. That is how, actually, you have to see it this way. Arteries and veins have relative percentage of elastance and compliance. Arteries are more elastic because they have a lot of elastin fibers and less compliance. Their recoil is more than their stretchability, but they do stretch. They do extend. When the left ventricle pumps blood into the aorta expands. That is its distensibility. That is its compliance. But then it recoils as well. That is its elastance. And the recoil is more than distensibility. It would come back faster and with more strength, then it can expand. On the other hand, veins, if you add blood to them, they'll just become expanded and they'll stay expanded. So they're more stretchable, they're more distensible, they're more compliant, their capacitance compared to elastance. They do come back as well, but not with as much force as elastic arteries would come back. So all vessels have a factor of elastance and compliance in them. The ratio is different. Elastance would pull inward and compliance would let a vessel be expanded. Now, the formula for the compliance is volume over pressure. So it's a ratio of volume and pressure. What that means is, think about a vein. If you add more volume in it, if you add more blood in it, it just keeps expanding. Of course, it cannot expand forever. It would rupture and die. But up to within physiological limits, it would just keep expanding. What is the benefit of expansion? It would have more volume in it, but pressure would be maintained. On the other hand, think about arteries. You add more blood to it. Heart does that all the time. Add more blood to it, artery expands, then it wants to come back through the elastance, and that causes pressure in the arteries. That is why blood volume present in the arterial system is called stressed volume, and the blood volume present in the venous system is called unstressed volume, and that is why veins are reservoir. Why are they reservoir? Because they are distensible, because their capacitance is high. Okay, so now let's look at some of the properties of the veins and arteries in this context, that is, in the context of compliance and elastance. Arteries and veins, compliance. Arteries are less compliant and veins are more compliant. Elastance, that is recoilability. Of course, arteries have lots of elastic fibers in their tunica media and even in the intima. They are very elastic, they would recoil. When you put pressure in them, they would recoil. What is the benefit of that? Remember, in case of aorta and the large vessels, that benefit is called wind castle effect. What does that mean? When you distend an artery, it would try to recoil and push the blood. So heart would pump the blood in the aorta. Now aorta is going to act as a wind castle and slowly smooth the blood flow. That is why the blood pressure stays between 120 to 80. It doesn't go from 120 to 0. That effect is because of the elastance. How about veins? Are they elastic as well? Yeah, they're elastic, but they're not so elastic that they would push the blood out. So their elastance is low. Their compliance or capacitance is high. That is why they are reservoir vessels. How about stress on the blood? Yes, in the arteries, the blood is under stress. That is why we have blood pressure, systolic and diastolic. Higher stress is systolic, lower stress is diastolic. Never goes down to 0. On the veins, there is no stress. It actually can be 0. How about the volume? In the arterial system, you cannot put a lot of volume because the arteries are pushing on the blood in them and trying to get it out. Veins have high capacitance, high compliance. So they just stretch. You add more volume in them, they stretch. So veins are containing 2/3 of the blood volume. They are the reservoir of the blood. 2/3 of the blood sits in them. Pressure. Arteries have high pressure because of the recoil, because of the elastance. Veins do not have that kind of a pressure because they are distensible. They do not recoil. How about the flow? Flow is going to be equal because that is a rule that as you move the fluid through a closed circuit, the flow at every point is equal. So flow is equal. Okay. So now let's see, you might encounter these graphs. This is the graph of volume over pressure for aorta's compliance. So this curve here, this line here plots the compliance. So now what is happening is, let's say you are heart and you are pumping blood into the aorta. As you pump one unit of blood, the pressure in the aorta goes up. Why? Because aorta is expanding, but it is trying to recoil. So that causes pressure. This is like picking up something and squeezing on it. That causes pressure on that thing. If I pick this up and I don't squeeze on it, there is no pressure. Then heart pushes more blood into it. That causes even more pressure because of the recoilability, that because of elastance, less compliance, and so on. So you would see a graph like this. Actually, at some point, it would become like this as well if you break the physiological barriers and you stretch it so much that it cannot recoil anymore. Now, let's look at the veins. We put more volume, let's say volume 1 in the vein. Does the pressure go up? No. Why? Because the vein has capacitance. It just stretches. That is called compliance. No pressure change. Okay. How about one more unit? Still no pressure change. Your vein is sitting there having fun because it is capacitance vessel. It can expand and it can stay expanded and so on. But at some point, vein also has physiological limits after which it cannot go further. And now if you add more volume to it, then the pressure would start increasing up to the point that either you stop putting the volume or it would burst. So that is the capacitance and elastance and their relationship to each other and the blood vessels. Thank you.